everyone, and welcome again to Medical Insight by Direct Events. I'm Dr. Smith, and today I'm joined by my colleague, Dr. Davis. Together, we explore medical conditions in simple English for healthcare students and professionals around the world. Today's episode is very special. We will talk about Alzheimer's disease, a condition that affects millions of people globally. It's not only a medical issue, but also a social and emotional one.
Thank you, Dr. Smith. Hello, everyone. Alzheimer's is something I see often in my medical practice, and it has a huge impact not only on the patients, but also on their families. So I'm really glad we are discussing it in detail today.
Dr. Davis, could you start by explaining what exactly Alzheimer's disease is?
Of course, Alzheimer's is a neurodegenerative disorder. That means it is a disease where brain cells are slowly damaged and eventually die. This process leads to problems with memory, language, reasoning, and eventually the ability to carry out daily activities. It is the most common cause of dementia, which is the general term for memory loss and other cognitive difficulties serious enough to interfere with daily life.
So, in simple words, it is a disease of the brain that gets worse over time, mainly affecting memory and thinking.
Exactly. And what makes Alzheimer's especially difficult is that it's progressive. It doesn't stop once it begins. Symptoms start slowly but get worse year after year.
Can you tell us more about the symptoms? How does Alzheimer's usually start?
The earliest sign is usually memory loss. Patients often forget recent conversations, appointments, or where they placed objects. At first, families might think it's just normal aging, but with Alzheimer's, the memory loss becomes more frequent and more disruptive. Later, patients may have language problems, like difficulty finding the right words or trouble following a conversation. They may also become disoriented, forgetting the day, the season, or even getting lost in familiar places.
I have read that behavioral changes are also common.
Yes, very much. Patients may experience mood swings, anxiety, or depression. As the disease progresses, they may become suspicious, aggressive, or socially withdrawn. And in advanced stages, patients lose the ability to carry out basic tasks, such as dressing, eating, or even recognizing close family members.
What do we know about the causes? Why does Alzheimer's happen?
That's a good question. Alzheimer's is linked to abnormal proteins that build up in the brain. The two main ones are amyloid plaques and tau tangles. These proteins interfere with communication between brain cells and eventually lead to their death. The biggest risk factor is age. Most people with Alzheimer's are over 65. But there are also genetic factors. If someone has a family history, especially with certain genes like APOE4, their risk increases. Other risk factors include high blood pressure, diabetes, smoking, obesity, lack of physical activity, and low education or lack of mental stimulation.
So, lifestyle really matters.
Absolutely. Healthy living can make a big difference in reducing the risk or delaying onset.
Let's talk about diagnosis. How do doctors confirm if someone has Alzheimer's?
Diagnosis is based on a combination of methods. First, doctors use cognitive tests, such as asking patients to remember a list of words or to draw a clock. Then, brain imaging, like MRI or CT, can show changes in brain structure. PET scans can sometimes detect amyloid or tau proteins. Blood tests are also being developed for earlier detection. Importantly, diagnosis also involves ruling out other causes of memory problems, like depression, vitamin deficiencies, or thyroid disorders.
Is there a cure for Alzheimer's?
Unfortunately, no. There is currently no cure for Alzheimer's, but there are medications that can temporarily improve symptoms or slow progression. For example, drugs like donepezil, rivastigmine, or memantine help with memory and cognition. But beyond medication, management includes supportive care, psychological support, physical therapy, occupational therapy, and very importantly, support for the family. Caregivers often suffer stress, so they need as much attention as the patients.
So treatment is really about improving quality of life, not curing the disease.
Exactly. And that's why awareness and early diagnosis are so important.
Can Alzheimer's be prevented?
We cannot fully prevent it, but we can reduce the risk. A healthy lifestyle makes a big difference.
Regular physical activity,
A balanced diet, like the Mediterranean diet, rich in vegetables, fruits, fish, and olive oil.
staying mentally active, like reading, learning new skills, puzzles,
Social interaction, avoiding isolation.
controlling blood pressure, diabetes, and cholesterol.
Studies show that people who keep both their body and brain active have a lower risk of developing Alzheimer's.
Exactly. I agree with you.
Alzheimer's is a growing challenge for our societies. As populations age, more and more families will face it. But with knowledge, support, and healthy living, we can help patients live better and longer.
Thank you so much, Dr. Davis, and thank you to our listeners for staying with us. If you enjoyed this episode and found it useful, please don't forget to subscribe and share our channel, Medical Insight by Direct Events. Your support helps us continue creating simple, clear, and valuable medical content for everyone. Together, we can build a stronger medical learning community.